Many youth use nutraceuticals. Here are the statistics. 28.9% used one or more types of CAM therapies. And this figure is twice that of those without mental health concerns. So many people are looking for nutraceuticals. And this was a survey done for youth between the ages of 7 and 17. So when we're looking at vitamin D, we know that, and I'm talking about in children, when I'm saying the only data that we have that I'm aware of when looking at depression. Now, as far as monitoring, anytime we check a vitamin D level, we also want to check a calcium level because an abnormally elevated calcium concentration in a patient with vitamin D deficiency could be because of hypercalcemic disorder, with primary hyperparathyroidism being the most common. So you don't want to give somebody with hyperparathyroidism more vitamin D. Rather, you would want to address that. Are those who are taking antidepressants. So kids who are taking antidepressants, I like to know their vitamin D level because studies in adults suggest a negative association between SSRI use and bone mineral density. And during adolescence is when a huge amount of bone is being placed and consolidated. So there's a greater rate of bone loss with SSRI use and increased risk of fractures in adult studies. So certainly I want to make sure that if a kid is on antidepressants, that we're maximizing and making sure that the bone mineral is ideal. Those with psychotic disorders, given the correlation between low vitamin D and psychosis, as well as ADHD and depression. Now, many other kids, if I suspect that they don't have much access to sunlight or that their diet might be deficient, then I can also check it. It also depends on if the family has insurance or doesn't have insurance, and sometimes we'll empirically treat as well.
B12, we really don't have a lot of studies looking at adolescent depression using B12. I, in my practice, do check it, and it's rarely low, but I do supplement. And again, with the broad spectrum micronutrients, it's an easier way to get a lot of this addressed without having to look at each little thing and trying to replace it. So in children with healthy GI systems and a diet that's adequate in richness of the meats and dairy and eggs and all of that, most of our kids that we're seeing in the clinic do not have an insufficiency or deficiency. However, like many of you, I have lots of kids who are vegan or going through all kinds of fad diets to lose weight, etc. And so unfortunately, it's becoming more and more likely that someone might come to your office who's having mental health conditions that in part are from reduced nutritional efficacy in their intake. And so it's good to look into this and at least have a sense of what's happening in the system.
Essentially, L-theanine is a great one. The only study that's really been done in kids is looking at boys with ADHD, showing that their sleep efficiency improved.
L-theanine is one of those easy things to use when you see someone with anxiety and you don't have time to figure out exactly what's going to be the best thing, and they have a little bit of sleep trouble too. Something pretty safe to start while you're doing your workup and getting labs, etc. Because a lot of times they come back in 2 or 3 weeks and they're like, oh, he's already, a little bit better with anxiety, sleeping a little better. So it tends to be an easy thing to add on early on.